6. Role of occupational health physicians. Outline of presentation. Framework of O-physician practice. OSH statistics as drivers of O services. AMR, reporting and recording obligations. Challenges to O practice. Occupational health. ILO and WHO definitions. Promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. Prevention amongst workers of departures from health caused by their working conditions. Protection of workers in their employment from risks resulting from factors adverse to health. Placement and maintenance of the workers in an occupational environment adapted to their physiological and psychological activities. Involved disciplines. Occupational medicine. Nursing ergonomics. Psychology. Hygiene. Safety, etc. Safety officer must be a regular employee of the company. Training and qualifications. Qualifications. Must have passed the examination given by the Philippine Regulatory Board of Medicine. Licensed to practice medicine in the Philippines. Trainings. Completed and passed at least 56-hour basic OSH training for O physicians. College of Public Health of the University of the Philippines, Manila. Any institution duly accredited by DOLE. PCOM. National Legal Framework on OSH. Article 2, Section 18, and Article 12, Section 3 of the Philippine Constitution. Book 4, Title 1, Chapters I and II of the Presidential Decree No. 442, as amended and renumbered. Republic Act No. 11,058, an act strengthening compliance with occupational safety and health standards and providing penalties for violations thereof, and its Urdu 198-18. Occupational Safety and Health Standards, as amended, rightward arrow OSH related issuances. ASCII. Alt. RA No. 11,058, an act strengthening compliance with OSHS and providing penalties for violations thereof. Regulatory framework related to O services. Role of O physician. Organize, administer, and maintain an O service program integrating therein an occupational safety program. Continually monitor the work environment for health hazards through periodic inspections of the workplace. Prevent diseases or injuries in the workplace by establishing proper medical supervision over substances used, processes, and work environment. Conserve the health of the workers through physical examinations, proper advice for placement, and health education. Provide medical and surgical care to restore the health and earning capacity of injured workers. Maintain and analyze records of all medical cases and prepare and submit to the employer AMRS, using Form DOL/BWC/047, as required by the OSHS, as amended, RA 11,058 and its DOL 198-18, and other related regulations. Conduct studies on O within the means and resources of the physician and the company. Act as an advisor to management and labor on all health matters. Report directly to top management to be effective. Role of O practitioner. Alt. RA No. 11,058, an act strengthening compliance with OSHS and providing penalties for violations thereof. From hazard-based to risk-based assessment. Focus on risk assessment done by the safety officer to determine classification of establishments with consequence on OSH requirements. Rights-based. Defined rights of workers, duties of employers, workers, other key players in the workplace. Inclusive. Recognition of sectors in vulnerable situations, i.e., micro and small establishments, in the application of OSH. Due process principle. Inclusion of penalties, guidelines on enforcement, investigation, and appeal. Regulatory framework related to O services. Occupational Safety and Health Standards, rightward arrow Employees Compensation Program, rightward arrow related DOL and government issuances. ASCII. Alt. Occupational Safety and Health Standards. Employees Compensation Program. Related DOL and government issuances. Role of O physician. Organize, administer, and maintain an O service program integrating therein an occupational safety program. Continually monitor the work environment. Alt. Occupational Safety and Health Standards. Rules and regulations on medical examinations as part of O services. Work accommodation. Workers' and employers' rights. OSH personnel complement. OSH training requirements. Workers' welfare facilities. Provision of PPES. OSH program. OSH reports. Penalties for violations. Enforcement. Employees' compensation program. Presidential Decree No. 626, 1975. Prescribed periodic medical examinations for the early detection of occupational diseases. Pre-employment and periodic medical examination for employees who are at risk of developing occupational diseases. Related DOL and government issuances. Measures in workplace prevention and control of specific health domain. Drug-free workplace. Tuberculosis in the workplace. HIV/AIDS prevention and control. Hepatitis B prevention and control. COVID-19 prevention and control. Mental health workplace policies and programs for the private sector. National policy on prevention and control of non-communicable diseases. Role of physician. Organize, administer, and maintain an service program integrating therein an occupational safety program. Continually monitor the work environment for health hazards through periodic inspections of the workplace. Prevent diseases or injuries in the workplace by establishing proper medical supervision over substances used, processes, and work environment. Conserve the health of the workers through physical examinations, proper advice for placement, and health education. Provide medical and surgical care to restore the health and earning capacity of injured workers. Maintain and analyze records of all medical cases and prepare and submit to the employer AMRS, using Form DOL/BWC/047, as required by the OSHS, as amended, RA 11058 and its DOL Do 198-18, and other related regulations. Conduct studies on within the means and resources of the physician and the company. Act as an advisor to management and labor on all health matters. Report directly to top management to be effective. Role of practitioner. Advise the employers, the workers, and their representatives in the workplace on the requirements for establishing and maintaining a safe and healthful working environment which will facilitate optimal physical and mental health for workers. Conduct periodic inspections of the workplace as required under OSHS Rule 1961.04. Act as an advisor to the employer, workers, and their representatives in matters concerning the organization, administration, and maintenance of an program. Maintain a reporting and records system and prepare and submit an AMR for the employer, using Form DOL/BWC/HSD/047, as required by the OSHS. Determination of work-relatedness of diseases. Work factors, hazards and risks, level of exposure, duration of exposure, timing of exposure, effectiveness of control measures. Safety and health behaviors, level of compliance to rules, health-seeking behavior, personal hygiene. Individual factors, age, health habits, exercise, nutrition, compliance to medical management etc., social behavior, tobacco, alcohol, drugs, risky sexual behavior, etc., medical history. Occupational and work-related injuries and illness. ASCII. Alt. Medical surveillance process. Legal and other requirements, hazard and risk identification and assessment OSH objectives and targets. Medical management, implement appropriate preventive or corrective efforts, fitness to work. Monitor effectiveness rightward arrow risk assessment rightward arrow is medical surveillance needed? Rightward arrow what type of medical surveillance is needed? What are the tests needed? Rightward arrow who will be included in medical surveillance? Rightward arrow interpretation of results rightward arrow determine intervention/strategies. ASCII. Alt. Occupational health services, medical examination. Pre-employment medical examination. Conduct of medical exam of a prospective employee for fitness to work. Inclusion of the following tests. Chest X-ray. Special laboratory examinations, as needed by the establishment. Periodic medical examinations. Inclusion of the following tests. Chest X-ray. Special laboratory examinations, as needed by the establishment. Conduct of follow-up exams on workers with findings. Conduct fitness to work or return to work examinations for employees upon work resumption. Special examinations. Conduct of hazard-specific or risk-based medical examination. Transfer examination. Conduct of medical examinations whenever an employee needs to be transferred to a different nature of work or task. Separation examination. Conduct medical examinations whenever an employee resigns or retires from work. Communication of results. Employees informed of the results from the examinations done. Occupational health programs. O policies and programs. Department Order No. 53-03. Guidelines for the implementation of a drug-free workplace policies and programs for the private sector. CSC-MC 13S. 2017. Department Order No. 73-05. Guidelines for the implementation of policy and program on tuberculosis, TB, prevention and control in the workplace. JMC No. 1, reiterating EO 187S.2003. Department Order No. 102-10. Guidelines for the implementation of HIV and AIDS prevention and control in the workplace program. CSC-MC 11S.2013. Department Advisory No. 05-10. Guidelines for the implementation of a workplace policy and program on hepatitis B. JMC No. 1S.2020. Department Order No. 208-20. Guidelines for the implementation of mental health workplace policies and programs for the private sector. CSC-MC 04S.2020. Elements. A. Advocacy, information, education, and training. B. Promotive and preventive strategies. C. Social policy. D. Healthcare services including support and referral systems. E. Benefits and compensation. F. Monitoring and enforcement. Risk-based occupational health programs. O. Policies and programs. Ergonomics program. Stress management. Hearing conservation. Heat stress prevention. Respiratory protection. Biologic monitoring, toxicology. Elements. Policy disseminated to all including management. Promotion and preventive strategies and services. HIROC. Medical surveillance. Monitoring and evaluation. Modified conceptual framework for worker health status. Socioeconomic factors, includes class, gender, ethnicity, work factors, hazard/psychosocial conditions, occupational and work-related injuries and illness, other illnesses not directly from work factors, occupational and work-related injuries and illness, behaviors risk-seeking, ignore rules, tobacco, alcohol, aerobic exercise, nutrition, sleep, sexual behavior. ASCII. Alt. Strategies to reduce compensation cost. ASCII. Alt. Anchored on a culture of safety and health. Prevention is the best strategy. OSH policies and programs. Hazard identification, risk assessment, and control. APES, early detection. Wellness program. Beyond compliance. Develop supporting plans. Communication. Worker participation. Education and training. Promotion of early incident reporting. Worker assistance programs, assistive technologies, counseling, financial support. Work accommodation. Case management. Timely, appropriate, continuous quality health care. Immediate medical management. Immediate incident reporting. Communication with worker and among team members. Follow-up, rehab, early reintegration, back to work policy. Timely referral to specialists. Compliance to health and safety regulations and legislation. Link to compensation and benefits. Workplace intervention. Monitoring and evaluation. Review of all cases of injuries and illness. Establish benchmarks of OSH performance. Incident investigation. Downward arrow. Risk management. Risk avoidance. Loss prevention. Loss control. The O physician. Standards of medical practice, management and administration of workplace promotive and preventive programs and services, legislations and guidelines influencing OM practice, occupational and work-related diseases, occupational medicine core competencies. ASCII. Alt. Occupational diseases. All industries, establishments employing 20 and over. ASCII. Alt. Percentage of surveyed establishments employing 20 or more workers by Occupational Safety and Health, OSH, policy program implemented. ASCII. Alt. Employer-reported diseases of workers and services made available by the establishments. Specifically, the analysis will provide data sets on the following: hazards identified by the establishments, O personnel, services, and programs available in the establishments, profile of AMR compliance, symptoms and diseases of workers. ASCII. Alt. Top 10 reported diseases reported in the workplace, AMR, 2020, OSHC. Tension headache is the leading type of illness reported in the workplace. ASCII. Alt. Top 5 reported accidents/injuries at work, AMR, 2020, OSHC. 97% of the total cases of cuts, lacerations, and punctures were reported by males. ASCII. Alt. Profile of establishment. ASCII. Alt. ASCII. Alt. ASCII. Alt. ASCII. Alt. Challenges. Evolving world of work, work arrangement, industry, and technology. Flexible work arrangements, remote work, hybrid. Work mediated by digital platforms, ride-hailing, service delivery, online shopping, etc. IT-based communication and work processes. Worker demographics, women, young workers, elderly workers, informal workers, other vulnerable groups, healthcare workers, essential workers. Evolving role of OSH focal persons at the enterprise level. Risk managers including infection prevention and control. O service provider, health education and surveillance, telehealth. Collaboration and linkages with public health authorities/local government. Addressing traditional and emerging OSH risks in a post-pandemic scenario. Monitoring of hazards and risks. Remote work. Work environment assessment. Monitoring of health effects, periodic and special medical exam. Managing communicable and non-communicable diseases COVID-19, mental health concerns, musculoskeletal disorders, cardiovascular disease. Compliance officer administrative reports, program development and implementation. Addressing OSH challenges. Communicating occupational safety and health. Utilize social media and digital platforms. Develop appropriate communication materials for target audience. Engage social media influencers to communicate OSH messages effectively. Monitor reach and effectiveness of social media messages. Alt. Worker empowerment, education and training, self-reporting of conditions for improvement. OSH point person capacitation, HIROC, utilization of simple, practical tools to evaluate workplace exposure. Enterprise-level action, improvement of workplace conditions towards or beyond compliance. ASCII. Alt. Roles and responsibilities. 1. Company physician. Medical assessment and management, including fitness to work assessment. Medical surveillance, determination of work-relatedness. Management of non-occupational diseases. Return to work. Fit to work. Fit to work with work modifications. Work accommodation. Work restrictions. Unfit to work. Advice to management. Work with OSH team. 2. OSH team. OSH risk management. 3. Management of O services. Ensure availability of O services. Ensure that, so far as is reasonably practicable, hazards and risks to health are controlled by taking the appropriate measures of protection. Provide work accommodation arrangements. The O physician. Clinical practice. Consulting. Compliance liaison. Disability/compensation management. Public health. Research. Academia.